What did the brain say to the brain tumor? You're getting on my nerves. Brain tumors are the second leading cause of cancer-related deaths in cancer victims under 39 years old. In 2013, 69,720 new cases of brain tumors were diagnosed in the United States, and in 2010, 688,096 individuals in America were living with the diagnosis of a primary brain or central nervous system tumor. Unfortunately, many victims of brain cancer do not receive positive prognoses and suffer headaches, nausea, memory loss, personality changes, uncontrollable speech and muscle functions, seizures, and other adverse symptoms. Specifically, tumors in the eloquent cortex like the Broca's area and the insular region of the brain where mood, speech, mobility, memory, vision, and sensation functions are controlled prove to be especially devastating for patients suffering from them as they lose the ability to carry on normal lives. These detrimental symptoms compel physicians to probe medical practices for a way to heal individuals with brain tumors, and up until now, resecting the tumor or removing it has proven to be the best method to treat cancerous tumors in the eloquent cortex. However, the resection of tumors in eloquent areas of the brain is difficult because neurosurgeons have to ensure that they are not operating in a manner that will damage brain cells and cause even further deficiencies in the patient. In an attempt to resolve this issue, neurosurgeons are approaching a technique where, with the help of a neuroanesthesiologist, they wake up a patient during a craniotomy and perform this procedure, which is called cortical stimulation mapping. This type of surgery is called a wake craniotomy. During this procedure, neurosurgeons electrically stimulate parts of the brain where they think they may operate for the removal of the tumor. To see if it is unsafe to operate on a region of the brain, neurosurgeons electrically stimulate the area while the patient performs a task such as reading a sentence or moving an arm. If a patient is unable to perform the task while the electrical signal is emitted, the neurosurgeon maps the area that was stimulated on a magnetic resonance image study that was performed prior to the surgery by placing a marker. Utilizing this method is thought to have allowed for safer resection of tumors by preventing further neural deficiencies in the patient. This permits neurosurgeons to effectively remove the tumor in an attempt to improve surgical outcomes. However, the ethicality of intraoperative cortical stimulation is debated because the method does require that patients are awake while the brain is exposed. Hence, it is intraoperative. And some clinicians argue that the technique can be traumatizing and therefore its benefits do not outweigh its disadvantages. However, the use of intraoperative cortical stimulation mapping should be utilized in the resection of tumors in the eloquent cortex of the brain because it prevents possible neurological damage due to surgery, and through the use of proper procedures will not be a traumatizing experience for brain cancer patients. Tumors in the eloquent cortex impose injurious effects on brain cancer victims, with many of the patients losing their ability to speak and move. Progression of treatment of tumors in all areas of the brain, including the eloquent regions, is necessary to save the lives of thousands of patients affected by brain cancer every single year. Until a cure is discovered, we must use the techniques available to us, one of which is intraoperative neurological mapping, and we need to continue to probe medicine for a treatment that will cure all.